Alright, so in this video, I'll talk about the different muscles of the hip, the pelvis, and the thigh, and how they function in the body. First, I'll talk about the iliopsoas group, which is a combination of the iliacus and the psoas muscles together. The origin of this muscle is in the inner surface of the ilium, base of the sacrum, and the sides of the lower vertebrae, which is about here from these areas. And the insertion is in the lesser trochanter, which would be right about here. And the concentric contraction for this muscle is hip flexion and external rotation, which is bringing the leg outward. The eccentric contraction would be it concentrically contracts to control hip flexion, and the antagonist action would be hip extension, bringing the hip back, which elongates the muscle. The next muscle I'll talk about is the tensor fasciolata. The origin of this muscle is in the front of the iliac crest and the surface of the ilium, which is about in this area, and the insertion is in the lateral side of the thigh, 2/3 of the way down, which is about here. And this muscle concentrically contracts to cause hip flexion and internal rotation, like a hacky sack position. And this muscle eccentrically contracts to cause hip flexion, and it works as an antagonist to cause hip extension. The next muscle I'll talk about is the sartorius. The origin of this muscle is in the front of the superior iliac spine, which is right in here, and the insertion is the base of the patella and the patellar ligament, which is about right here under the knee, under the kneecap. This muscle concentrically contracts to cause hip flexion, knee extension, and external rotation, and it eccentrically contracts to control knee flexion and hip flexion. It works as an antagonist to cause hip extension, which is the muscle elongating. This muscle I'll talk about is the rectus femoris, which is one of the biggest muscles in the quads. This muscle, the origin of this muscle is in the front inferior iliac spine, which is in this area of the hip, and the insertion is the base of the patellar and patellar ligament also, which extends to about down here under the kneecap. This muscle concentrically contracts to cause hip flexion with the extended knee, and it also causes knee extension. It eccentrically contracts to control hip flexion, but works as an antagonist to cause knee extension. Again, the next muscle I'll talk about is the hamstring group. The first one I'll talk about is the biceps femoris. The origin of this muscle is on the lower tuberosity of the ischium, which is about right in this area. And the insertion is the lateral side of the head of the tibia and the head of the fibula, which would be about right here on the lateral side of the knee. The semimembranosus, the origin of this muscle is in the tuberosity of the ischium, which is about in the same area, and the insertion is on the posterior surface of the medial condyle of the tibia, which would be about right. Hamstring muscle I'll talk about is the semitendinosus, which is the origin is in the ischiotuberosity, which is about here, and the insertion is in the upper anterior medial condyle of the tibia, which would be about right in this area. Hamstring muscles concentrically contract to cause hip flexion and also knee extension, but eccentrically contracts to control knee flexion. And this muscle works as an antagonist to cause knee extension, also as it concentrically contracts. The next muscle I'll talk about is the gluteus maximus. The origin of this muscle is in the posterior gluteal line of the ilium and lower posterior sacrum, which would be about in here, and the insertion is in the gluteal line of the femur and iliotibial band of the fasciolata, which would be right here under the glutes. The concentric contraction for this muscle is the hip extension with the bent knee, external rotation of the hip, and this muscle works as an antagonist to cause hip flexion. The gluteus medius, this muscle has an insertion of the outer surface of the ilium right below the crest, which would be right in there. The insertion would be the back middle surface of the greater trochanter, which would be right in here right under the glute muscle also. This muscle concentrically contracts to cause hip abduction and external rotation as the hip abducts. It eccentrically contracts to control hip abduction and works as an antagonist to cause hip adduction. You bring the leg across. Talk about the hip adductors, which is the pectineus, which the origin is in the front of the pubis, which is about right in this area, and the insertion is between the lesser trochanter and the linea aspera, which would be about right here. Next is the adductor brevis. The origin is in the inferior pubis, which would be right in here, but lower. And the insertion is in the lesser trochanter, which would be about the next muscle I'll talk about with the hip adductors is the adductor longus, which the origin is in the front of the pubis, about right here. And the insertion is in the middle of the linea aspera, which would be right in this area. And the adductor magnus, the origin is in the ramus of the pubis and the ischial tuberosity, which would be about here. And the insertion in the linea aspera, which would be about in this area also. The last muscle I'll talk about of the hip adductors is the gracilis. The origin is in the medial ramus of the pubis, which is about here. And the insertion is in the medial tibia, right below the condyle, which would be right in this area. These muscles concentrically contract to cause hip abduction and also flexion, but eccentrically contract to control abduction, and it works as an antagonist to cause hip extension and hip adduction. Last muscle I'll talk about in this video is the deep external rotators, which the origins in the front of the sacrum and the back of the ischium, which is about here. And the insertion is in the superior posterior girder trochanter, which is about right here under the hip. These muscles concentrically contract to cause external hip rotation and eccentrically contract to control external rotation and prevent internal rotation. But this muscle elongates and works as an antagonist to cause internal rotation.